The University of Queensland Rural Clinical School is part of a national network of rural clinical schools funded by the Australian Government to improve the rural medical workforce. Our focus is to provide high-quality medical education and training experiences for medical students in rural and regional areas. We have established campuses in Rockhampton, Bundaberg, Hervey Bay and Toowoomba, and train students in communities right across central and southwestern Queensland. By joining the Rural Clinical School teaching team, you can take an active role in helping students have a positive living and learning experience in your community, making them more likely to take up rural practice and enhancing the sustainability and viability of rural healthcare services.
In the beginning, I had a lot of anxiety about my capacity to be a teacher of medical students. And along the way, I've learnt a lot, and I now rely on having a student to keep myself up to date, to keep myself motivated, and also to contribute to the development of my profession. It is now just part of what I do. Students have added a vibrancy to our practice and helping us grow where we want to grow to in working in the new model of general practice, and they give really constructive feedback because they've worked in other places. What we think we do for them is show them how general practice works, how to be a doctor, what the role of it's like, what the challenges are, how to not take the problems of the day home, to your own life, how to live in these communities and in being able to work as a professional. Our type of medicine is practiced largely in small businesses that doesn't get talked about in other areas, so we can show them front end how Medicare works and how PBS works and what all those things mean. The initial challenge is your own, and that's your own self-evaluation. Can I really do teaching? Am I any good at this? And what have I got to offer? But that quickly goes away when you have a student with you, because it is amazing, what you do have to offer, and then that becomes a reward for you in terms of being able to share and mentor. It does take a little bit of experience and being a bit flexible to work out what your practice needs are, and each doctor in the practice has a different set of needs. But what works well for us is if we're really busy and if we have a spare consulting room, and we try to organise our bookings so that that is the case, we get the student to examine the patient or take a history, examine the patient, and then bring that to us. This is what I think is going wrong, this is what I think we should do, and we can then go, that's a great idea, have you written it up on the notes? And yes, I agree, or well, you can then learn around that. And the patients really appreciate that opportunity to have a little bit more time, because that's what the students can also bring. In a busy day, there may be other things the patient wanted to talk about, but they're conscious of, the doctor's busy, I better not bring it up. The student's interested, and so they will often get not only the current agenda, but the hidden agenda. Works well. I have a lot of respect for students as resources. We've had to learn how to do that. And I have an example of this week. We have a medical student in our practice. I have a farmer who is suffering from low mood. So I asked the student who'd just done a psych term to do the mental health mood assessment for me. And it worked so well. At the end of the interview, the patient got up, shook the student's hand and said, "Thank you so much. I've got a lot out of talking to you." So that for me says it all. I think our evidence is very strong that we do recommend it to our colleagues. When we're at meetings and they're talking about the frustrations of their day and not being able to get through agendas, we go, well, why don't you have a medical student? Or we call them student doctors, because they can do the ECGs and they're really great at doing evidence searches, and you know what? Sometimes they know a little bit more current medicine than we do because they've just done a medicine term or a psych term. So we do, and we find it keeps us current.
By joining the Rural Clinical School teaching team, you are eligible for an academic title with the University of Queensland. This provides you with access to UQ library resources and a research support network. Most important benefit you'll receive from teaching students is the self-satisfaction that you're helping to train tomorrow's rural doctors.